Hi, my name is Liam Spencer. I'm a researcher based at Newcastle University working on this evaluation of the Best Start in Life Alliance in South Tyneside with Dr. Ruth McGovern as the PI. As with many other parts of the North East, children and families in South Tyneside have high levels of need, with some of these individuals being at particular disadvantage. The practice members of our team from South Tyneside Council worked with local people in their communities to develop a new alliancing approach to help children and families have the best possible start in life. As part of this evaluation of the alliance, we are focusing on three key component interventions. The first is the locality hubs, which bring together different professionals to support children and families into one team in one building, and there are currently 2 of these in different areas within the borough. Secondly, the mental health champions. These are practitioners who have been identified in settings where children and young people engage, and their role is to promote and support positive mental health. Thirdly, the young health ambassadors. These are young people who have volunteered to help support their peers in order to live healthier lives, as well as advocating for service improvements. So we want to know if this alliancing approach really makes a difference for the residents of South Tyneside. In order to do this, we are undertaking a realist evaluation, working closely with children, families and practitioners within the borough. We are speaking with professionals who provide services, as well as those families that use the services, in order to ask them what they think about that support that is provided to them. We will also be collecting health information that is routinely collected by South Tyneside in order to monitor any changes after the approach has been introduced. As well as this, we will be estimating service costs and identifying what the benefits are that come from the alliancing intervention. Realist approaches focus on what works for whom, why and in what context. The first stage of our theory development derived from searches of academic literature on alliancing approaches, as well as the inclusion of key policy documents from South Tyneside. We used this literature to develop initial programme theories consisting of context, mechanism and outcome configurations to help us better explain and understand the potential observable outcomes for residents in the borough. It's very much an iterative approach and involves testing and refining these programme theories with key stakeholders, including practitioners. Through the iterative search process of the literature and the synthesis, it became apparent that some of the core constructs of alliance-based approaches were also evident in approaches with other titles, in particular place-based approaches. Through the analysis of this literature, it was determined that there was an overlap between alliancing and place-based approaches, with several principles from those approaches underpinning alliancing approaches. It's these key generative mechanisms that we used to develop our initial programme theories. We have developed 7 initial programme theories, which can be broadly grouped into 3 categories, and I will summarise them for you now. Firstly, the system level. Alliances use a whole systems approach by integrating interventions and services through the formation of common goals. This reduces system fragmentation and provides services which meet local population need. Secondly, the local focus. Alliances build on local capacity to tailor services to meet local need, thus influencing change at the local level, which promotes a better service user experience. And thirdly, culture. Alliances enable cultural shifts through commitment and trust at all levels to transformation, which facilitates innovation and collaborative working across services within the alliance. So far, we have undertaken 12 initial theory gleaning interviews with key stakeholders from South Tyneside, and we're going to be using the data we collected with those practitioners in order to refine and develop these programme theories. In terms of the next steps, obviously the COVID-19 pandemic and the lockdowns have not only had a huge impact on some of the services delivered in South Tyneside, but it has also restricted the delivery of this project. So for example, myself and some other colleagues were due to be embedded within the council itself. However, that hasn't been able to happen as of yet. However, in terms of positives, we have, as I said earlier, been able to move forward with qualitative data collection. So following the refinement of our initial programme theories, we are now moving into the next stage of qualitative data collection with the mental health champions, young health ambassadors, and also the staff based in the locality hubs. This is then going to feed into our further qualitative work with families in the local area. Also, we are going to be using quantitative data to examine the impact of the alliancing approach and the component interventions. But again, much of the routine data hasn't been collected due to the pandemic, so we are going to have to evaluate what there is available to us now. And there will also be an economic evaluation looking at the costs associated with the service delivery. Thank you very much.